Hello friends, welcome to our very first episode of Torus Health, your go-to digital healthcare service aggregator. We are here to simplify the lives of those who are managing their chronic health condition, right from diagnostic to medicine, insurance, teleconsultation, and nutraceutical products. We have got all you covered. Tune in for our expert advice and stay updated for all things Torus Health. So at Torus Health, we are on the mission to shift you from illness to wellness. In today's Torus Health podcast, we will talk about integrated health. As our ancestor nailed it, medicine is often used when we are sick, but true health care, especially nutraceutical, is all about staying well. Let's make it simple and explore how to shift our journey from being sick to being healthy. For the same reason, in today's episode, we have a liberty to have Dr. Mili Shah with us. Dr. Mili Shah, she is an expert in integrative medicine and she is a pioneer in the field of ozone therapy. She is the president of Ozone Forum of India and also she is a trustee of Bisleri Charitable Trust. Let's understand from her what is ozone therapy. Hello, Dr. Mili. Welcome to our show.
Thank you, Nilüfer, for having me here, and let's understand more about ozone therapy.
Okay. Thank you, Dr. Mili. So let's things kickstart off. Let us understand what is ozone molecule and why everyone is talking about ozone therapy nowadays. So since ozone therapy, I think it's a new word for our listener as well. Since I'm a pharmacist, I'm working in healthcare industry so long, but I haven't heard about it. But yeah, I've read a lot about it nowadays and it's fascinating. So it will be pleasure if you will brief us about ozone molecule.
We all know oxygen is O2, whereas ozone is O3. So O3 becomes an energetic molecule of oxygen. Now if you look at the Earth's surface, around 20 to 30 kilometers above the Earth's surface, we have something called good ozone blanket. It's a stratosphere. It's a filtration mechanism of our Earth system. So this stratosphere filters harmful rays of sun because of this ozone blanket. So when nature is using something like ozone as a sunscreen for us, why can't we use something so good for our own health benefits? If you say ozone was invented in 1840 by a German scientist, Friedrich Schweben, but it was mainly at that time used for labs or for water industry, for disinfection. Slowly people realized that our body is also 70% water. So we can use the same benefits of ozone, as in which is germicidal, for our body. So this was the concept slowly started developed in Germany. Cubans are very much ahead in research in ozone therapy. Russians are also very much ahead in research in ozone therapy. Now why do they use ozone? It's because it's a very cost-effective treatment. Oxygen is utilized by every cell of your body. So when you give ozone, which is a mixture of 99.5% to 95% oxygen and 0.5 to 5% ozone, when you use that in your body, it can give you multiple benefits. And oxygen is utilized by every cell, so it is going to be a oxygen healing therapy. That's why recently, in recent times, with so much of health consciousness, people are starting to use ozone therapy for their health benefits. But I would say it is a natural molecule which can be used for your own treatment. And the beauty is you can prevent disease, you can treat disease, and you can control the disease. So that's how it can work in acute, chronic and all degenerative diseases. So when you look at ozone, it's a quite different molecule and conventional treatments or the normal physicians do not know it, because in recent times it has been researched quite a lot. So the best of research which has happened are from 1970 onwards, when they invented PVC, silicone. The delivery system of ozone became very easy, and that's when people started using ozone therapy. World War I had used ozone to treat septic wounds and mustard gas burns. To that extent, in 1911, in Lancet Journal, which is the highest publication journal, they put up saying that ozone is beneficial for diabetic complications, for tinnitus, for whooping cough, for tuberculosis, insomnia, and many chronic diseases. So there is enough research, enough work. But yes, now the consumer is aware that we want to benefit our health, so we want to prevent diseases, and that's why people use more of ozone therapy nowadays.
Yeah. Oh, that's a fascinating. Means that's a history of ozone therapy, and it's very interesting. So we just want to know, Dr. Mili, how it works and how means we people can get treated with this therapy.
Sure. So before we go to ozone therapy work, you should know something called oxygen deficiency symptoms.
Yeah.
Okay, many people when they come to us, they ask us, why should I take some oxygen? My hands are fine, my legs
Yeah.
are fine.
Correct.
You also might be
Yes.
thinking like that.
Yes.
And why should I use ozone therapy? Okay, so I would ask you, have you anytime felt cramp in your body? Have you anytime felt acidity in your, or sleepy or sluggish suddenly after certain exertion? Or you fall sick often, immunity is low, or you have insomnia, or you don't get restful sleep? Have you got any of these?
Every day we get all these symptoms because we youngster, we are not very habitual with good lifestyle. Yes, we do face this lifestyle related issue.
This is called oxygen deficiency symptom.
Yeah. And
Okay.
acidity is common though every day. Yeah.
And this oxygen deficiency will not show on any scan or on any blood
Yeah,
work.
yeah.
Yes, in blood work I can say that in CBC, which we do complete
Yeah.
blood cell count, there is a parameter called RDW.
Yes, yes.
That is red cell distribution width.
Yes.
And if you see, if that has increased, means you have lack of oxygen supply to your tissue.
Oh.
Means you might have some of these symptoms, as an oxygen deficiency. So now, when we are looking at treatment of ozone, once you give ozone, so it's always a mixture form, more of oxygen, very minute quantity of ozone, which is a controlled dosage. So we have a well calculated dosage for different patients.
Okay,
So if
depending
you
upon
come,
the disease,
yeah,
yeah.
if you come and your symptoms are different, it will be tailor made for you, the dosage, and somebody else would have a different dosage. So when you take ozone therapy, it will dissociate into O2 inside your body, and it will have a nascent oxygen which combines with the acids and PUFAs and all your bodily compounds and form the chemical messengers. So there is no ozone within 5 seconds inside your body. It will be absorbed as an oxygen. So when you take ozone therapy, there's always an oxygenation, and there will be oxidation to your disease part. So whatever is the condition which we say. So when you give ozone, it has different targets. Like with RBC mechanism, it will improve your oxygen delivery to the tissue. With WBC, it will immune modulate your system. With platelets, it can improve your growth factors. You can have a better healing mechanism. Your cell rejuvenate faster. It generates your super gifted erythrocyte and a stem cell like effect. So when you take ozone therapy, we are not only changing your biochemistry, but you're also improving your physiological performance.
Okay.
So together, ozone gives, it's a holistic, whole, WHO only. So we look at patient as a holistic.
Okay.
And when you talk about, or when you give ozone, it can give you really, really, really far multiple fold results. So when you take ozone therapy, you get improved circulation, immune modulation, germicidal. So it's a very powerful infection control you get. At the same time, healing improves, cell rejuvenation improves. So I don't call it a symptom management, but it is a holistic treatment.
Okay. Yeah. Okay. So how it works in the chronic disease? Means it works well, and like nowadays there is so many cancer patient we see. So how it works with those chronic diseases?
So let's take chronic diseases. Okay, the biggest is diabetic and diabetic complications. Of course, we'll go on cancer also. Why diabetes? I think India is one of the leading nation in diabetes.
In every house we have one diabetic patient.
Yeah. So in diabetes, what is there? It's there is excess of sugar in the blood. It should be inside the cell for cell to work, but it is not going inside the cell. It is circulating in the blood.
Okay.
So when you put sugar maybe in this water, what will happen? The water will become thick. So your blood is thick. Okay, so and all your arteries and veins are like a straw. So when your arteries and veins are like a straw and there is something thick, your body has to have extra energy to pump it. And say legs, diabetic people usually have neuropathies. Or you have eye, diabetic retinopathy or a nephropathy. Means these are the areas where you need your blood to be flowing properly. Now you have thick blood and it is not passing. So what happens? There is lack of circulation. And that is the result. You have all these diabetic complications. When we give ozone therapy, it is enhancing the glycolysis, means it breaks down the sugar in the plasma, in the RBC, and it improves your sugar control. So the blood will not be as thick or there will be not as much sugar in your plasma. Second, it improves your oxygen delivery to the tissue with the improving heme oxygen curve. So there will be better circulation there. So all your neuropathies, all your diabetic retinopathies can be answered by at least 20 to 30 sessions of ozone. So it's not a magic molecule, but for diabetes, people take lifelong medicines.
Yeah, of course,
so if you take few sessions of ozone to improve your well-being, it can be definitely helpful. So like this, any chronic disease, if you say, it has oxidative stress. So when you have oxidative stress, somewhere your biochemistry is compromised. Somewhere your function, the physiology and your pathology is compromised. So when we give ozone therapy, we are trying to correct it and trying to improve you holistically. So that is one. Then you asked about cancer. Now why cancer is so rampant now? Did you hear that your grandmother anytime got cancer?
No.
Not even, because we were all very, very used to live in an oxygen-rich environment. Okay, you'll be very happy to know that in 1936 and 1940, Dr. Otto Warburg did two researches on cancer. First one was that he proved that if the cell does not get enough oxygen, it starts mutagenic changes and the cancer originates. And in 1940, he again proved that if those cells get enough oxygen, the cancer reduces. So the baseline of any cancer is hypoxia, means that cell does not use any oxygen for their energy. It uses only glucose. And that glucose metabolism is now we eat so much of super saturated carbs. Like we eat bread, we eat all the junk food. We have everything which opens up in the packet, so much of processed food. Okay, everything together leads to hypoxia, and you have genetic makeup for it. Also, certain genes are also working towards it. So if you have a cause, you have a supporting factor which are carcinogens, and that's why the cancer is so rampant. Now, what is the main root is hypoxia. We give ozone therapy, we are correcting hypoxia. So that's how ozone therapy has been really improving and beneficial as an integrated oncology treatment. where we support patients. I do not claim that I'm curing them. Cure is, I think, in God's hand, or some, but we have to address 3P model in cancer, which is psychology, physiology, and pathology. So when we give ozone therapy, we are addressing the pathology and physiology, improving the body environment, so the medicines which they are taking can work better and can work faster, and that's how it can be really, really beneficial for cancer treatment also. Coming to acute diseases. So, for example, for acute diseases, you went outside, you met somebody who had cough and cold, you will contact some infection, and you will fall
Less of
sick.
immunity,
Now, why would you fall sick? Less of immunity.
Immunity.
Yes. So, why is that immunity less? Maybe you have lack of nutrients, the diet is faulty, and your sleeping pattern is not right. Okay, so you have to correct those plus improve immunity, and then you can be beneficial. So ozone tries to improve, or it modulates your immunity, and that's how I think it is wonderful treatment for acute and chronic conditions. If you really want to take up hypertension, now if you have hypertension, means your endothelium of the blood vessel has to work better to improve the circulation. Now endothelium is not enough working, or it has less nitric oxide, and that's when you get hypertension. When you give ozone therapy, we heal the endothelium with platelet mechanism, and when you heal the endothelium with platelet mechanism, you can have better nitric oxide, and that also improves your circulation, and together it can give you. But keep this in mind, it is not a one-time treatment. You have to do at least 20 to 30 sessions of it, and if you come to our clinic, it is very cost effective. So any treatment would be between 200 to 300 rupees. Of course, every doctor has the different ways of or different setups. It all depends upon where you are going, what you are taking, but definitely it is going to be a good boost to your well-being if you do ozone therapy.
Yeah, and I don't think so it has any side effects like medicines. Like in cancer patient, we see so many side effects.
On top of it, we use ozone therapy to reduce the side effect of chemo and radiation. To make you understand, chemo and radiation is using destroying technique.
Destroying technique, yes.
Okay, you take some medicine which can just bombard the cells. They are wanting to kill only cancer cell by chemo, but our body is made up of normal cells also.
Also, they kill
So
that.
they also get hampered. If you have taken ozone therapy before chemo or radiation, you have primed your good cells with oxygen.
Okay, yes.
So when they come in contact of any destroying agents, then they can fight against that, or your antioxidant defense mechanism is improved with ozone, and that's how it can help in side effects. And ozone by itself do not have any side effect. Why? Because it's an oxygen-based treatment.
Yes. Oh my God, that's a very informative. Means we all are. I think we will learn so much today. So see, in Indian society, we see all of these treatments are not that much acceptable. So since you are in this field so long, so what are the challenges you face? What are the myth and misconception you want to clear for our listeners?
Sure. So the first myth, people think ozone is toxic. Now there is a political, or what we call it, lack of understanding.
Yeah.
Now when ozone layer senses that there is lot of pollution in the troposphere, which is our environment, it tries to come down and tries to nullify that pollution. Okay, when it is very easy to measure the ozone in the atmosphere, all the government bodies use ozone as a measuring tool for pollution. So that's why there is a negative connotation that ozone is toxic. Okay, but I want to make it clear through this podcast that ozone is not toxic. It is not the cause of the pollution. It is the effect of the pollution. Because we have modernized our life so much. We have so many CFC molecule released by our vehicular exhaust or the environmental air conditions. Now you see air conditions are everywhere. And when they release a carbon fluorochloride, that is CFC molecule, it destroys the chain of oxygen. Okay? But modernization is part of our growing. So that, of course, we should look into global warming and not have so much of, or plant more trees so that there is more oxygen and there is less destruction. But that is like a huge, this thing. So that's why I would say that myth that ozone can be toxic is wrong. It is not the cause but the effect of the pollution. The second, the way of treatment of ozone is not through breathing. So when we say oxygen based treatment, people think it is breathing. But you can't breathe ozone directly because your lung cells, your lung bronchoalveolar lavage fluid do not have enough antioxidants to fight against the small ozone dosage. So you can't breathe ozone directly. You have to use it in a different way. So the treatment methodology of ozone is like an ozone enema. It's called rectal insufflation. We have injections of ozone which works on pain management. We have a lot of external application, a lot of ozonated saline, so like IV. But it is patient-centric. We look into the benefit of what will be good for the patient and then devise. So because we can't inhale ozone directly, they say, oh, it's not right. No. But our body can use oxygen in different ways. So that's how we have more than 21 different applications of ozone, and it can be really, really beneficial from cough, cold to cancer, from 9-month to 90-year-old. It can have a huge dosage, minimal dosage. So you can give whatever is required for that patient in a very tailor-made way, and it can really be beneficial.
Okay. So what are the growth you're seeing now since so many years you're doing this? So it is increasing in terms of knowledge and everything, how the patients are approaching towards this treatment.
So I would say we've been promoting ozone since 2002. That is Bisleri Charitable Trust. Previously we had to answer a lot of queries from the patient. What is this? How is it given? Why rectal? Why this? But now with so much of awareness about, which is created by us, word by mouth by patients from different places, patients have really, started understanding, and if you need this therapy, they find us.
Yes, absolutely.
Okay? We have trained more than 2,700 doctors across India. Recently we went to Philippines also to train the doctors there. So we trained some 31 doctors there. We've been invited by Malaysia, Kenya, doctors are thinking. So knowledge of ozone is increasing. Patients are now finding us very easily. So, there is an interest, like Torus Health wants to know about ozone. So there is an interest about that also, that lot of common people are understanding the need of the hour, that we must preserve our health. And prevention is better than cure. I think that is,
of course.
Do good and do not do any harm. So we follow these two simple rules: do not do harm and do good to patients. And it is increasing slowly. The world is going towards integrated health.
Yes. So we are bringing back the roots of.
So idea of integrated health is you should have your ancient wisdom of wellness. You should live your life according to the rules of circadian rhythm and not haphazard. And don't fall sick. Try to be healthy
Healthy, yes.
than being diseased.
Yes.
Okay? And chronic diseases do have answers if you correct your lifestyle, if you correct your diet, if you
Correct.
correct your environment,
Correct.
and you have some holistic treatments, you can really improve your health multifolds.
Yes, yes. Because we often go to any doctor, they will ask about what is your daily routine. So yeah.
Yeah.
So we have to correct. our
But do they
routines.
do something about your daily routine?
No, they don't. They just give us a medicine and like, okay, you have to do this, but they don't give the root cause of it.
So I would say, you know, like if they start spending at least 5 minutes on
Yeah.
their, please don't do this, or
Yes,
you
yes.
know. So
And patient also, if they will start doing advising patient, they will listen to them, because in our family, if we will say my mother or my father, they won't listen to us, but they will listen to doctor, of course. So yeah, we should practice that.
it will come. Everybody
Yeah,
has to.
eventually, yes,
yeah.
yes. And after pandemic, people are more very much into their internal health. Yes. So
And immunity.
Immunity. Yes,
Everybody is conscious about their own self now.
Yes. Correct.
The main importance, I don't want to fall sick.
Yes.
And what can I do for it?
Yes.
Then they can find.
Correct.
So that's how I said, like, you know, it's a beautiful molecule which can improve, like, so prevent, control, and treat. So that's how.
Okay. So prevention is very important.
Yes.
Okay. So that was means very informative, Dr. Mili. So as we wrap up, where do you see the future of ozone therapy, and what advice you want to give, to our listeners?
Okay. So where do I see future? Future is going to be really great. Why? Because people are understanding that there is a need of the hour, that you must look into your health. We've trained more than 2,700 doctors, and now we are also working with National Institute of Naturopathy. We are working on different collaborators. The people, lot of hospitals also come and ask about a lot of private clinics, and so more the patients, better is their health, and better is their family health. So I would say one person gets treated in the family, they'll bring 10 more.
Yes, correct.
So future is going to be really good. And government is also working towards integrated health. So I think even that will give a better perspective towards these holistic healing, treatments. And then one message which I would want to convey to the not the patients, the listeners. Patients know, we tell them. The listeners, that look into your breathing pattern. If you come to know that you are not breathing enough the way you need to be, so do deep breathing, do yoga,
Yeah.
do exercise. This will replenish your oxygen metabolism. But if you can't do, of course, ozone is definitely there to treat you. But pay attention to your body. It always gives you a signal before it throws a disease to you.
Yes.
So pay attention, be aware about yourself, and I think, work on your lifestyle, work on your diet. Make sure you don't go for easy fix.
Yes. Temporary fix.
No. So like we if we are feeling hungry, we pick up a biscuit and we eat. Instead of just that, you can pick up a banana
Yeah.
or chana or peanuts or something which is more healthier. Okay, so biscuit, I'm not against any biscuit manufacturers, but it has lot of preservatives, it has lot of gluten. So work towards your health. It doesn't come on a platter in
Yeah.
front of you.
Yes.
You have to work towards it,
Yes.
and you should be good.
Yeah. Because nowadays also, if we fall sick, mom and all, they'll say ghar ke nuske wo apnao, then go to
Definitely.
doctor. Yeah, so we have to first
So
do
kitchen
study.
is your best medicine.
Yes.
Your best medicine is inside your kitchen.
Yes.
You can have haldi. See, we talk about curcumin.
Yeah, correct.
It's an extract of haldi.
Haldi, yes.
हाँ, it will not be as powerful as curcumin, but अगर हल्दी का दूध पी लिया तो क्या हुआ?
Correct.
Instead of going for a antibiotic for your sore
Yes,
throat.
yes. And antibiotics are, of course, not good for body.
No, you need them. See, I'm not against any conventional medicine.
Yeah,
You need them,
yeah.
but not on an easy step.
Because on a day, I think you are making habitual to antibiotics are habitual to your body. They will create the tolerance.
And then there will be resistance.
yes.
Then there will be multi-drug
yes,
resistance.
yes, and-
Why are we getting the super bugs?
Yes.
Hmm? So it's because we've habituated for so many antibiotics that you need to find a third molecule to
Yes.
work on yourself.
हाँ. अब
So,
क्या better
अब
लगे?
क्या लगेगा?
Yes.
अब क्या चाहिए?
Correct.
Hmm.
You nowadays अगर किसी को I have a throat infection चलो antibiotic ले लो.
मैं
So it's
बोलूँगी
very easy.
2-3 lemon shots ले लो.
Yes.
हाँ? Ginger shots ले लो.
Yes.
Take a ginger juice, add lemon, add honey, have it 2-3 times. See how your sore throat improves.
Correct. So that's a very, I think we all need all this information nowadays, and thank you so much for giving us.
Most welcome, Nilofer.
So friends, that was Dr. Mili Shah with us for the today's episode. I hope you have got lots of insight related to ozone therapy. She has cleared so many misconceptions, myths related to the ozone therapy. I hope you all have enjoyed this episode a lot. So stay tuned with us for our next episode. We will assure you to bring lots of fresh content related to integrated health in our next episode. Thank you.